Monica Ndege. I am the country director for Maternity Africa, or another name is known as Kivulini Maternity Center. We are very happy to have you with us. And what we do, our main mission is to make sure that women have safe deliveries, that children are born safely and mothers remain safely. And our mission, we are a Christian organization, so and is a non-profit organization. So all our services are free of charge, and it's amazing when people come here, our patients, because in other hospitals, relatives have to bring food to the patients, but here the women come, they get the free treatment, like the ultrasound, the medicine if they need it, but as well as the care. And our care, if you go outside, we have the pillars. We believe in dignity, because the women we save normally are women who are very marginalized. Some of them, as you know, some of them have fistula. They had a problem during difficult deliveries, then they ended up having a fistula. So they are leaking urine, sometimes mixed with feces. And because of poverty, they don't even have pads to take care of themselves. They're always smelling. So those are the kind of women we have. And even those who are coming here for delivery, they are from the very low class. So sometimes they come, they don't even have pads, they don't have the necessary equipment, or the necessary, how can I say, even clothing for the babies. So what we do, we make sure that we treat them with respect. Some of them need counseling, and we have our social worker who is always going around to see, to interact with them, and even ourselves. Whoever we come across any person with a challenge, then we do counseling, and some of them, well, after delivery or even when they're here, we discover that they don't have even enough clothing, no clothing at all for the babies. So we buy them clothing for the babies. And yeah, so that's our service, and we are very happy, and they really feel very respected and very loved, and that's what we are all about. Yeah. Thank you.
Hi, my name is Michael Hines, the Director of Fundraising here at Maternity Africa. I'm delighted to explain to you a little bit about what it is that we do. Maternity Africa was established in 2013, and we worked initially in some local hospitals in Arusha at that time, where we provided good maternal health care services and increased outcomes for women living in deprived and marginalized areas at that time. 2018, then we opened our new hospital ourselves, Kivulini Maternity Center here on the edge of Arusha city. So here at Kivulini Maternity Center, we serve vulnerable and marginalized women and girls of childbearing age from really around the surrounding villages and communities where there is a marked lack of good maternal health care services. We also serve fistula patients, women suffering from obstetric fistula coming from all over the country. We typically do up to 150 of those surgeries every year, all on site. All of our services are provided free of charge to the woman. We have strict criteria in terms of who can obtain services here. So basically any woman who can pay for services should go elsewhere, otherwise they're taking up resources that are available for those who are needy. In terms of deliveries, we do around 2,700 deliveries a month. 2,700 deliveries a year. We're hoping to increase that to 3,000 deliveries per year over the next 2 or 3 years. We also provide a full suite of antenatal care services, postnatal care including immunisations, family planning services and counselling, and we also do screening and treatment for cervical cancer. And at the present time we're also offering vaccinations for COVID-19 as well. Our hospital has 56 beds. Sometimes it overflows and we have to use other facilities around the unit here with mattresses on the floor, which is a fantastic problem to have. We have about 75 staff, all Tanzanians, a mixture of male and female in the clinical side, and then also all of our maintenance and back office functions as well. income and expenditure, our annual budget's around about $1 million a year to run the whole thing completely. And we have a range of donors, mostly from the United States, Europe, including Great Britain, and also Australia. One of the new programs that we're planning to start in 2022 is a training program for midwives who are employed at other medical facilities that are less well equipped than we are here. One of the major problems in Tanzania is women or midwives get trained up, but often their training is inadequate in the sense that it's very theoretical, lecture-based, book-based, with very little hands-on practical experience. So what happens is these midwives, once they're qualified, they go to other medical facilities to deliver babies without having really had any experience themselves. So that is obviously obvious risks for the mother and for the baby as well, and often leads to midwives feeling disheartened and inadequate for the job. So Kivulini Maternity Centre is also a training facility. So this new training that we're offering will train initially 32 midwives in 2022, rising to 40 in 2023 and 2024. And these midwives will be here for 6 weeks each, where they're learning on the job from our own experienced midwives here in Kivulini Maternity Centre. The idea is that will then raise capacity locally. These trained midwives will go back into their own sending facilities where they will be better skilled, better competent, better confident, and more able generally to provide good maternal health services for the women in their communities. The overall aim really is to reduce maternal mortality and infant mortality in Tanzania, or at least to contribute to that. So we're very much looking forward to that program starting early in 2022. We also try to be as ecologically friendly as possible, and here we have some solar panels where we produce all of our electricity during the day, right up until 7 p.m. At night, and it can store some of the electricity also in batteries. We also produce a lot of our own iron-rich vegetables. Iron is very, very important as a dietary ingredient for pregnant women and other patients who we serve who are often anemic. These are largely watered by our own grey water, where we recycle as much water as we can. And a lot of the waste also generates for us biogas, which we can use for the majority of our kitchen needs. We also offer community outreach programs as well, whereby our mobile clinic team goes out into remote areas, taking with it all they need for antenatal consultations, family planning, and cervical cancer screening. So that's into villages in the locality where many women are unfortunately unable to come here for treatment themselves, perhaps because of family or work commitments. So in total we do roughly, in any given day, there could be 100, 120 plus antenatal and postnatal consultations combined with what we do in the clinic here and also in our mobile outreach.